Excellent. Good morning, everybody. Happy November 1st. You are at the Neighborhoods Ready for School Fall Learning Community Meeting. We are so happy to have everyone here. We have some staff from First Five, and then we have, it looks like we have representation from each of our Neighborhoods Ready for School sites. And we have some new faces this time around too. I think specifically I'm seeing some names from Roots that this will be your first meeting, Jasmine. So welcome. Tiffany, welcome. I don't think we've met, so welcome to the group. LaRonda, I was just looking at a picture of you from many years ago. So you were when we were in the office having this meeting at First Five's office in Alameda. So that was a long time ago. Excellent. Well, I think we'll go ahead and get started if everybody's ready. So I am Liz Greger, and I am the program administrator for the Neighborhoods Ready for School strategy at First Five. And what that means is that I help bring together all of the sites that we have throughout Oakland and Union City to meet with each other, share learnings. I also do a little air traffic control if you need supports from First Five. I cheerlead you on, help you work through your reporting and your contract things and your budgets. And I just am so happy to be in community with you all this morning. We have a great presentation from our policy planning and evaluation staff, and they'll be talking about our kindergarten readiness assessment and the results that we have from that. And then we'll do some talking through what those results look like and, kind of how you see yourself in what we found and what our parent advisory group found and community advisory group found. So appreciate you all so much. And I am going to pass it over to Laura Schrader and Deanna Garcia to start the presentation.
Great, wonderful. Thank you so much, Liz, and hello, everyone. It's nice to see all of your faces. I'm Laura Schrader. I'm the Senior Administrator over Data and Evaluation, and I'm joined by my colleague, Dr. Jane Burnsweg, who will also be helping present, and Deanna Garcia. So you're going to have a few of us presenting to you today our kindergarten readiness assessment. We're really excited to bring the findings and recommendations from this study to you all because the Neighborhoods Ready for School grantees have been such a partner in our kindergarten readiness assessment. So excited to be in conversation with you all today. We have Leah, would you be able to, oh, great. Wonderful. So we're going to give a little bit of background on the kindergarten readiness assessment. And let's see if I'm able to maneuver as I think, oh, great. So for us, kindergarten readiness is the North Star for First Five. It's a population result that really guides our work, that all children are ready for kindergarten. Our work is to ensure that policies and systems and communities and schools are supporting families and children by creating conditions that position all for success. So it's our North Star, but it really is a collective endeavor to make sure that children and families have the conditions necessary for kindergarten readiness. And it's something that all of your work really is contributing to, as we'll see as we kind of go through the presentation. Great. This is a helpful overview. Within First Five, we kind of believe in a whole family, whole community, whole child approach, which is really something that the kindergarten readiness study reinforces. Our framework at First Five is to be looking at place, people, and policy across all of our work. And that is something that's really supported by the kindergarten readiness assessment. So getting into the details of the kindergarten readiness assessment. Oh, here we go. So just an overview of this year's kindergarten readiness assessment. Whoops. Sorry, it's got a mind of its own. Here we go. One more over. Yeah, great. So First Five has been doing kindergarten readiness assessments since 2008. It's a biannual study. Beginning in 2015, our approach to the kindergarten readiness assessment really began to evolve in an intentional way to be more participatory in nature and to better demonstrate the connection between community conditions and kindergarten readiness. The findings and recommendations from our study point to systemic inequities and show how our county can invest in communities, families, and schools to increase kindergarten readiness. We were really thrilled with the level of engagement in our kindergarten readiness assessment this last year. It's been it's a difficult time for schools and for families, but we saw a large amount of engagement. Over 2,000 families and caregivers completed the survey that we sent out, which was a half-hour survey on what they're seeing with their child, what are their needs, what are the supports that are working. We had close to 700 early care and educational professionals be able to also participate in our survey, talking about what they see with young children. And this was the first time that we were able to actually survey ECE professionals and get that kind of view and perspective. And then we had 284 TK or kindergarten teachers also complete a survey to participate and share their perspectives of what they're seeing in sort of the TK-12 space at this time. So really great engagement kind of across multiple stakeholders. There we go. So just a little bit about the participatory nature that I spoke of. We really had community involvement through each phase of our kindergarten readiness assessment. So in September and November of 2021, we brought together a research advisory group who were able to provide feedback on everything from research questions to our sampling approach, who we're talking to the survey tools themselves, making sure that those surveys that I mentioned were clear, that the tone was appropriate, that we were really getting at questions that were important to the community. We also were involved with the community in the data collection itself, and that took place in December and January of 2022. In order to have that level of engagement that I shared, we really worked through trusted messengers within the community. And those trusted messengers included all of you, all of the Neighborhoods Ready for School grantees, working with your clients, working with the community to have families and caregivers really share their perspectives and experiences. So that was really made possible by the close relationships that trusted messengers have in the community. In February through May, we went through the analysis of all of the data. We worked closely with a research partner who was crunching all of the data, and we brought that to the research advisory group to look at the findings, to help interpret the findings, and then to help us think about recommendations from those findings and how we should prioritize the recommendations. And we're just now starting to go into the dissemination phase. This is part of it, working with all of you, with our community-based organizations, with systems leaders, with just bringing this report to various communities. And the research advisory group is often invited to help lead those presentations, share their experiences from the kindergarten readiness assessment. And we also are very committed to making the data available to the public. So we have our report that's available, but we also make the raw data itself available to the community. We'll have dashboards, for example, for community members to be able to drill into the data. We have an open data file for folks that really want the raw data and doing analysis themselves. And so that's a really important piece in terms of bringing the findings to the community. We think that this is one of the largest local data sets, or the largest local data sets, from families and educators at this really pivotal point in time for us, how kids are doing, how families are doing, kind of through the COVID pandemic. I just want to, I'm sorry, we skipped a couple of slides, so I'm just going to back up a second to sort of give the overview of the contributing groups to the kindergarten readiness assessment. So I spoke a little bit about the research advisory group. So just taking a step back, the research advisory group was a group of 30 community members. Half were parents who were paid for their time to participate, and the other half were community members that might be leaders in community-based organizations, systems leaders, educators, and they would all come together as part of our research advisory group to really advise on the study in those phases that I just spoke of. This was really done in partnership with a number of research consultants as well. So you can see down below the guiding agencies for the kindergarten readiness assessment. So First Five was the lead in sort of commissioning this study. We worked closely with a group called ASR, who's been a longtime partner. They've been doing the kindergarten readiness assessment with us since 2008, and were helping us with the crunching of the data and the writing of the report. They attended many of the research advisory group committee meetings to be in partnership with community and hear directly what community members were saying. CCER, who you all are familiar with from the Neighborhoods Ready for School evaluation work, they also facilitated our research advisory group. So some of the things that were very nice that they did was the parents would actually meet separately in a subcommittee prior to the full research advisory group. It was a diverse group. It was a multilingual group. And they had an opportunity to, prior to the full meeting, go through the findings and ask questions. Notes were taken. And in the full research advisory group, we actually started the meeting with the notes from the parent subcommittee. And the University of Oregon Rapid EC was another partner of ours in the research, in the kindergarten readiness assessment. Some of you may be familiar with the Rapid EC program. They have been doing national surveys of families with young children between the ages of 0 to 5 through the pandemic. These little pulse surveys they've been doing on a whole host of areas, from financial stability to health and wellness to mental health, experiences of discrimination. So they had a really rich set of survey questions, and our research advisory group would look at those questions and think about, you know, are any of these questions things we want to ask locally? And then we're able to kind of compare our local results to the national sample. So those were the groups that were sort of contributing and involved in this year's kindergarten readiness assessment. Great. And so the research advisory group was just a critical part of our assessment this year. They attended a number of meetings. Like I said, they sort of were guiding the study from beginning to end. And these are the 30 members that were part of the research advisory group. Those that are in bold are members that were recruited through the Neighborhoods Ready for School grantees. So you can see each of you were able to participate through family members or through staff in the research advisory group. And I just want to take a moment to first thank you all, and also, yay. And also we have a member of the research advisory group with us here today. Oh, there you are, Chris. I see you on my screen. So Chris was a member of the research advisory group, and just wanted to invite any reflections or comments that you had on the process and the study.
Yeah, thank you so much, Laura, and good morning, everybody. Folks that don't know, I'm Chris Nguyen, Program Manager at the Mandela Family Resource Center here in West Oakland, and always great to be in community with everybody. So it was really an honor, and I have such gratitude being a part of the Research Advisory Committee. And first, I really want to commend the First Five team and the research team at large for how intentional and how human-centered this particular experience was, not only for us as providers, but especially for our community members. I know our two families, Amani and Danae, who are part of the advisory group, really felt held and honored in terms of being able to have their voices lifted. And just the small intentionality of how we move was really, in a big way, why I think this research study was so robust just across the board. As an example, when the team and Laura and her team sent out emails, right, there's Spanish translation, right, of the same thing. These little small things actually matter significantly. And one of the things that we hope, 2-3 years from now is, Google has a option where it can automatically be translated into multiple languages and things of that nature. But just want to bring up these small examples that were really poignant, and I thought added to the richness of the experience. And additionally, the breakout groups were really intentional. The guiding questions were really intentional. When we went into the breakout rooms, there was a facilitator, and it really felt like everybody had equal say in being able to have their voices lifted. And it really was a model of the mental model that Laura shared earlier, where parents were at the center of the work that we do, and caregivers were at the center, and it really did feel that way, and it really did honor that. Which was great. And it was really amazing about the agency that was really exhibited for everybody, right? So I had a great experience. And the most important thing is I learned a lot just being in space with other providers. This is why I always appreciate spaces like this, because every single person here on this screen do great work in your communities, some of which is just enhancing the beautiful work that you already do, and some of which is really being creative with new ideas and new partnerships that will come to mind. And for our program and our team here, we're always honored to learn and hear from everybody because it helps us grow. It helps us be better. And when we're better, we are able better to show up for community as well. So it was a really great experience. And I'm so glad, Laura, and everybody here, that the survey results were so robust, right? Over 2,000, touch points, across the Bay Area talking about early childhood. Really feel not only for myself and my team, but for Lincoln as a whole, all the way up to our CEO, Allison Beckwar, that this will have reverberating effects, hopefully, in Sacramento and even through policy as well. So it was really an honor, and I give thanks for being able to be a part of the group.
Great, thank you, Chris. And I know all of First Five is just so grateful for the wisdom and participation and just engagement of community members and of you as well in this process. So thank you for that. Great. So I spoke a little soon about this, but again, this is sort of the various phases and how the research advisory group was engaged from the very start of the research questions to the dissemination, and just our partnership with community on this study. So that is a little bit on the process. I'm going to turn it over to my colleague, Jane. You're not on my screen, but I'll just introduce Jane. Dr. Jane Burnswig is an internal evaluation specialist here at First Five and has been a lead on the kindergarten readiness assessment over the years and in this study as well. And so Jane, I'm going to turn it over to you.
Okay. Thank you so much, Laura. And thank you everyone for giving us the opportunity to present today. I'm really honored. I'm going to be tag teaming a bit with Deanna Garcia, who I'm going to be presenting some of the results, and Deanna will be talking about the policy recommendations based on those results. And I wanted to start with the concept of priority neighborhoods, which was a big focus of our work this round. And you can see that there are 9 zip codes that we really focused on. The red outline is where you sort of fit into the picture. Those are the neighborhoods ready for school catchment areas or zones. And the priority neighborhoods, again, are areas that we know have traditionally been really underserved in Alameda County. There's also, it's an area where COVID rates were higher. And so some resources have been put into those neighborhoods, as you well know. And then I'm going to try this new. Oh, it worked. So exciting. Okay. Technology is always fun. What I wanted to, Laura started talking about who participated in the study. And we're so proud of the fact that over 2,000 parents and caregivers took the time to fill out our survey. Half of them had incomes under 50,000, and 26% reside in a priority neighborhood that I just talked about. You can see their race, ethnicity, primarily Hispanic, Latino, and Black. For TK, we also had TK and K teachers participate, 284 of them. 82% were kindergarten, and a smaller but nice group of 12% were TK, and they had quite a bit of experience. And you can see that their race and ethnicity is generally a bit different than the families that we surveyed. The ECE professionals, we had Anna Miera, who's on our staff, who really led the way in terms of surveying them. And we had both a family childcare and center-based providers. They also had quite a bit of experience, and almost 20% reside in or work in a priority neighborhood. Okay, next slide. Oops, let me go back. I just went too fast. Okay, this is really our framework. And as we all know, that readiness happens in families, communities, and schools. And within those settings, there are conditions that make it more or less productive in terms of kindergarten readiness. And so we've really wrapped our heads around these conditions in terms of financial stability, thriving neighborhoods. And you can see these are all along the road to kindergarten readiness. Early care and education, family health and well-being, kindergarten transition supports, and supported educators and systems. And in the big right-hand side, there's the sunshine, and that's all about being free from discrimination, which we know is overarching in the pathway, in the road to readiness. We're going to be, I think, focused when we break out into our groups. You'll have an opportunity to actually discuss these in more depth. And so now I'm going to go into, well, the other thing I wanted to just make a point that you guys in the Neighborhoods Ready for School, you directly provide access and referrals to all these stops along the pathway to readiness, or along the road. So you're involved in each and every one of these. And we'll have an opportunity to talk more about it as we go on today.
And Jane, I see that Chris has his hand raised.
Oh, okay.
Hey, thank you, Liz. Thank you,
Yeah.
Jane. And you might
Yeah.
have, you might will get to this, so feel free to tell me to mute
Sure.
myself, and I'll go away. I was really, just fascinated by this graphic here when I first read the report, and this is something that, my team, I want to introduce this to my team and really thoroughly walk through this, but I was waiting on this call to be able to do so. I know Appendix D talked a little bit about the methodology around this, and you mentioned this is the roadmap towards what First 5 considers based off of the research, kindergarten readiness. Is this a continuum, or is this something that can really vacillate back and forth? Or what was kind of the thinking around this particular road and where each item was kind of laid out. I had a curiosity around it. Thank you.
I can start with the response. That's a great question, but then I'll let my colleagues fill in. I don't see it as a continuum in that, building, it's all the pieces at different points in time are important in different places. So they're all kind of equal in my head. But I'm happy for others to weigh in to answer Chris's question.
I think it's a great question. And as Jane mentioned, for me at least, each of these conditions are connected and build on each other to some extent. Whether or not you have access to early care and education can influence your kindergarten transition support. So each of these were seen as Jane was mentioning, important conditions. And for some groups, they may be focused very closely on certain stops along the way. And then some are also looking at it kind of holistically at each of the stops. I think the freedom for discrimination is one that we really purposefully put not as a stop, but as like that sun that's shining down, because as was raised in the research advisory group, almost each of these conditions is sort of mediated through that lens. If you're experiencing discrimination, it influences and impacts your ability to really be able to access each of these sort of stops along the way. And would invite others, to share as well. But
hi, this is Lisa Forty with First Five, and hi, Chris and everyone. Sorry to be off camera. As I said in the chat, I've got a connection situation today, but I want to appreciate the question and the responses. And I guess I would just add that as an organization, our approach to kindergarten readiness, and I think, I appreciated, Chris, your comments around the advisory group and the participatory process. We've really, in recent years, as Laura shared and Jane did, been moving away from this idea of labeling children as ready or not ready for kindergarten and trying to show all of the factors that contribute. And it's this idea of community conditions. And because we want this data to be useful and action-oriented for educators, for families, for community members, it's sometimes, when you say things like structural conditions, it's hard to figure out like, well, what do you really mean? And so we tried to create something that was visually, accessible. There's still, a lot of words on here, but we try to illustrate when we look at the research and the data, and when we listen to the conversations from the advisory group, what are the themes and patterns that came up, and to try to use this to show what we mean by the types of community conditions and structural conditions in the sense of supported educators and schools. So this is for us really trying to kind of distill down, what do we mean by, it takes all of these things. It's not that that one is more important than the other, but there is some intentionality in thinking about, like, for example, financial stability as the first stop, because we've consistently seen that socioeconomic factors are predictive of a lot of the other stops along the road. And so just thinking about, there's a lot of, as Laura said, there's connection and overlap between them. And we hope that this is a helpful tool to show that it takes all of these things and they are connected, and that it's about providing this ecosystem of supports that encompasses place, it encompasses families, it encompasses schools, that all of these things are needed to support kids to be ready. So I hope that answers your question, but it is with intentionality that we've moved in this direction as an organization. So I appreciate you asking.
Absolutely. No, thank you, Lisa. I know we have to move on, but I think this mental model is such beautiful essence to it, because this is not First Five's thoughts on it. This is community, right? Over 2,000 respondents. And this is something that, just speaking for our program, I would like to use this one as a guide for how we move forward in terms of our program's strategic plan, right? Because with these elements lifted up, the community itself has lifted up as the factors. Now our team can really deep dive into when we're talking about kindergarten transition support, what are the examples of what do we need at the FRC and Mandela, what do we have and what we don't have, how do we find partnerships to be able to support that? So this is, I'm so excited about this truly, because this is just really, this is the framework that we need and we've been waiting for neighborhoods ready for school, and we can really go on to the next level with this framework, because we know this was truly informed by community, right? So thank you for that feedback, Chris Patsy. Appreciation.
Great. Okay, I'm going to keep going. So now I'm going to start to present the findings. And this is a really, really important finding for the Neighborhoods Ready for School, that receiving support, those families that said they received support through the Neighborhoods Ready for School initiative, were those families tended to rate their children as higher, with higher readiness overall. In addition, Neighborhoods Ready for School families reported using more community resources than other families. So that's something to really be proud of, I think, from your work. Okay, the next slide, and this is where I'm going to be team walking with, start with Deanna, but some of our community findings was that family income, as you can imagine, is strongly related to kindergarten readiness. And we found that there were families who participated in the Oakland Resilient Families program guaranteed income pilot, and they reported significantly higher readiness than other similar families. I'm going to turn it over to Deanna, who will talk about the policy implications of that.
Hi, everyone. Thank you for being here today. I'm just going to highlight a few examples that are included in our report. Our report includes a whole other list of comprehensive recommendations. So just reminding y'all, this is just a snapshot. But for recommendations to support communities through financial stability, a recommendation that came out is to increase job creation and workforce development with livable wages and economic supports like guaranteed income and support for families' basic needs. In addition, through the findings, we found that expanded access to quality, affordable housing and transportation and utility assistance is really important for families.
So for thriving neighborhoods, 65% of this is the families overall, the whole study, the 2,000 or so families that participated, 65 said help connecting to resources was really important to them. But only 12% of the whole sample of families had actually received that kind of assistance. Also, we learned that lower income families living in lower income neighborhoods, Black or Hispanic Latino families, and monolingual Spanish-speaking families were more likely than other families to say that community supports are needed. And
yeah, and to support thriving neighborhoods, the study recommends improving timely access to community supports, to family navigation and care coordination, and promoting family-friendly neighborhoods through investments in public schools, parks, playgrounds, affordable housing, transportation, libraries and communities, just to name a few. But these are all things that you're all working on already.
And we did ask parents to tell us what community supports were needed, and we have them ranked here. And I just want to point out to you the three top needs were free and affordable activities for young children, free and affordable childcare, and help finding and connecting to services. And this slide, this next slide, shows the differences between these kinds of resources. Whether you are at Neighborhoods Ready for School, identified yourself as part of having received services from neighborhoods ready for school or not. So the blue is no neighborhoods ready for school, and the orange red is neighborhoods ready for school. And we highlighted some of the really important ones, we think, based on the previous slide that talked about, what folks really wanted. And I think it's really interesting to see, some of these differences. So again, free food and basic needs, free diapers, and help finding and connecting to resources we highlighted. Okay, so I'm going to go to the next slide. Okay, now this slide, this is a little bit of a complex slide. I'm going to walk you through what it really means in this slide. So one of the things that research in all around the United States that looks at this has shown, and we know ourselves from our communities, that higher income families tend to report higher readiness. And that's shown by that 4.4 on the far right-hand side. And we also know that higher income families tend not to reside in the priority neighborhoods or zip codes that we presented early on. But the really interesting finding here is that if you were a lower or middle income family and you resided in a priority neighborhood, you had you thought your child had higher readiness than similar lower and middle income families who are in another zip code, not priority zip code. And really what that speaks to is the power and the value, I think, of what the services are that you're bringing into these priority neighborhoods, your services through the Neighborhoods Ready for School and other community agencies that are participating. Are there any questions about this slide? Anything specific? Because I know it's a little tricky to look at. Okay. And the next slide. Let me just. Okay. So there's some really interesting. This again is our whole sample. That nearly 40% of children missed a well child check since the start of the pandemic. And we know how important it is to be attending those well child checks. Children who attended well child visits had higher readiness. And in addition, children whose parents, caregivers reported fewer concerns about their child's mental health also had higher readiness. And in the report, the big report that you guys will have access to, Neighborhoods Ready for School families are also more likely to have a child who attended their well child visits during the pandemic. So that's good to hear. There will be a dashboard that is under construction. It's being tweaked a bit right now, but you can really look closely at that data, Neighborhoods Ready for School data, and all sorts of data. Once that's complete, we'll make sure you get that. And also just one last thing is that photo is Lisa from Tribe with her nephew. So you may recognize her. And now I'm going to go to Deanna.
Thank you, Jane. And to support the health and well-being of families and children, the study recommends expanding access to affordable, culturally responsive care, coordination, including mental health services for families and children in places where they live, so in their community, and also addressing the historical inequities and mitigating current experiences of discrimination that they may face when going to the routine child visits or trying to access mental health services or any other service in the community.
So regarding early care and education, as we noted in some of the earlier slides, that families reported their highest priority is needing free and affordable activities for young children and free and affordable childcare. 3/4 of families in the whole sample reported at least one barrier to accessing early care and education. And the most common challenges included the reduced hours and site closures due to COVID-19, as well as the high cost of care. And I just want to point out that free activities are a major thing that you guys for the Neighborhoods Ready for School are providing. So that's really important and commendable. And then Diana.
And to support families with early care and education, the study recommends increasing affordable quality childcare options for all families and expanding quality developmental and educational experiences for children in family-funded neighbor care, either, for example, through partnerships with libraries, through quality parks and recreation services that are affordable and accessible to everyone, and expanding family resource centers and communities and faith-based organizations, and through mobile programming at local parks. So all things you all do.
Exactly. Thank you. And that other stop along the way is the kindergarten transition supports. Use of kindergarten transition supports like attending parent meetings and other activities at the school is linked to higher activities, higher readiness. And this is especially true when fathers access these supports. The use of kindergarten transition supports, though, dropped from the 2019, where 87% of families had visited school and only 44% did so in this last 2021 assessment. Specifically to Neighborhoods Ready for School, we found that families who participate in Neighborhoods Ready for School were more likely to have used certain transition supports, such as receiving information from the school about kindergarten prior to attendance. They attended summer pre-K, and they had a father who engaged in these supports. Educators were asked if they had connected families to a Neighborhood Ready for School site, and 15% of ECE professionals and 5% of TK teachers and 10% of kindergarten teachers said they had referred families to at least one Neighborhoods Ready for School site. So I think that's an important transition activity role that schools can play.
And a few examples, thank you.
Yeah.
And a few examples of recommendations in this section, in this roadmap stop, include expanding access to kindergarten readiness activities and transition supports that are accessible to all families within their community, and also promoting policies and practice that are intentional about how they engage families, especially fathers and historically underrepresented family members in their programs and services. And as an example, we also include anti-bias and anti-racist trainings.
And stress among ECE professionals and kindergarten TK teachers increased during this time period, as we can imagine. Educators who reported high levels of stress were over 4 times more likely to say that they plan to leave the profession. ECE professionals experienced the greatest changes to their hours. 49% experienced a decline, and a decline in income. 57, that was about 57% during the pandemic. And some of you guys might recognize who this is, Maria Lazo from Union City Family Center, who is now retired.
And a few recommendations to support educators and system is expanding the workforce pipelines for early care and education for parents, men of color, multilingual, and neurophysically divergent adults, as well as increasing access to mental health and self-care resources for educators and consultation for behavioral health practices in the classroom. In addition, we have supporting communication, collaboration, and partnerships between the different environments where children are. So this includes the home, informal care settings, and schools, just as an example. And lastly, providing educators with resources to mitigate child learning loss. So in the study, we there were a few examples that were shared that are available in the comprehensive report.
I think the next slide is going to be Deanna.
Yeah, so what's great is we've already started to use these findings and recommendations in our own advocacy. In our website, you'll find examples of how we used it here locally, at the state level and federal level, to advocate for more community services to support children, families, and our systems. For one example that I want to point out is a comment letter that we drafted in support of San Antonio, of the master plan for San Antonio Park, really just highlighting the connection between safe play spaces, safe parks, and child development and school readiness. So all those examples are available in our website if you all like to take a look of how we highlighted our findings from our kindergarten readiness assessment and community supports. I'll go to the next slide. And really for our next part for dissemination, we're including presentations, again, to local partners, collaborative tables, national audiences that work on school readiness and supports for children and families. We've also started disseminating our KRA study with key partners such as the Research Advisory Group, partners that were heavily involved in making sure that the survey was accessible to members in the community, and participating educators. And we're also working on making sure that this study reaches a broad audience. So we're using our website and our social media outlets to share these findings. But at this point, I'd like to invite you all to share how you might include findings from this data in your social media, your proposals, or conversations with partners or elected officials. Just ideas that you may have. You can either unmute or add them in the chat. I'm starting to see a few faces back on the screen, so that's great. It tells me folks are back from their break. We'll get started in a quick minute.
Thanks, Deanna. I think it was nice to have a little break and get a chance to refresh ourselves a little bit.
All right, I see a few faces back on the screen. If you're off screen, if you can just give me a thumbs up, just to signal that you're back, so I can get started, be great. All right, I see a few thumbs up. Awesome. Okay. For this next part of the agenda, you're going to have time to select one of 6 different breakout rooms and focus on either some of these questions, whichever resonates with you, but the different questions for breakout rooms are going to be: how does your neighborhood's work align with these findings and recommendations? What is something that surprised you? How do you plan to use what you learned? And what would you like to learn more about? So we're going to have 6 different breakout rooms based on the 6 different stops on the roadmap, and those are financial stability, thriving neighborhoods, family health and well-being, early care and education, kindergarten transition supports, and supported educators and systems. But before y'all start reflecting on these questions, it would be great for y'all to introduce yourself. Just take a minute for quick intros. There's a lot of new folks on this call today. And also just a minute to select someone to do a quick report back when we're back from our breakout rooms. And at this time, I'm going to pass it over to Leah, who's going to give some quick instructions on how to choose your breakout room.
Okay, so I'm going to be opening the rooms, and you should see a selection and be able to choose your room. If for some reason you don't see the selection, you can also put it into the chat, and I will manually move you over into the room that you selected. So I'm going to go ahead and open them up now. Okay, and hopefully you guys are seeing that. Yep, I'm seeing that people are joining. Okay, I see that people are continuing to join. Just have a handful of people who are still making their selection or may need some help.
I need some help.
Oh, and that is, okay. Shanice, would you like to let me know where you would like to go?
Doesn't matter
Okay, let me take a look around and see.
because it's not popping up for me at all.
Oh, okay. I'll go ahead and assign you a room.
Thank you.
Mhm. And it may ask you to join, to click to join. Oh, I think it worked. All right. So we've got just a small number of people who haven't joined. Crystal, Dawn, Imelda.
Imelda, I would love to go into the family health and well-being,
Okay,
please.
I will
Thank
move you there. Okay. Tiffany. All right, so then that's just Tiffany, Haggerty, Dawn, and Crystal are still unassigned.
And Leah, I'm hanging out here for just a second to see if anybody wants to go into K transition supports. If not, I'll pop into a different room.
Okay, sounds good. We also have no one in ECE.
Yeah, I saw that.
Mhm.
So I might choose one of those based on if anybody's interested, but those
Okay.
might not be the most robust rooms. Oh, and it looks like I can also just as a technical point, I can
assign people.
rooms as well.
Yeah, because you have the co-host function.
Okay.
So you'll have a little bit more ability to direct people.
Excellent.
Hey, Maria, did you want to be put into one of the rooms just to see the breakout? Oh, and I was going to share into the breakout, right? Let's see.
Sure, if you can put me in the, let's see, transitions, well, there's no one there.
The rooms that have people in it are financial stability, thriving neighborhood, family health, and supported educators.
Let's do thriving neighborhood.
Okay, I'm going to send you there now.
Thank you.
Okay, I'm going to stop sharing my screen and then I'm going to try to share it to the breakout rooms. Okay, so now the breakout rooms should be seeing the breakout room questions. And then, so now we're down to Crystal and Haggerty and Tiffany. And Catherine. I didn't know if Catherine, you wanted to, oh, I see she just joined something.
You can send me to ready. They were ready for.
So there's a financial stability, thriving neighborhood, family, thriving neighborhood.
Mhm.
Okay, I will go ahead and send it there.
Thank you.
And then Crystal and Tiffany.
Hey, Crystal. How
Hi,
you
Liz.
doing?
I right now am not feeling the best.
Yeah.
I'm
Yep.
dealing with a lot of pain on my right side. So
Oh,
I just text Chris and told him I am going to go to the doctor. So I hate that
Yeah.
I'm going to miss the rest of the training. But he knows, and I want to hear more about it when I get back.
Wonderful. Okay, Crystal, I hope you feel better. And
Thank you.
It's good to see your face. And I
It's
hope
always good to see you. I wanted to make sure I said hi. Leah, thank you so much.
oh, pleasure. Take care.
Thank you.
Crystal.
Bye-bye.
All right. And so we're left, the last person is Tiffany.
Hi, I'm sorry. Can
Oh,
you hear
no
me?
worries.
Oh, yeah, I was just on the phone with a client, so I
Oh,
didn't even hear. I'm
yeah.
sorry.
So you're like, what's going on?
Yeah, I was working with the client right
No
quick.
worries. So we're doing breakout, and we have
Mhm.
the following room choices: financial stability, thriving neighborhoods, family health and well-being, supported educators. Oh, and K transition support. Hey, Liz, I see somebody went in there.
Catherine did, and then she's back here.
I
Oh, okay.
was because
Oh, okay.
and wherever you want me to go, I'll go. I was
Okay.
trying to follow the flow, so
Got it.
so I can jump into either or.
Okay. Hey, Tiffany, so where
Yes.
would you like to be?
And you can stay here in the main room
if you
too,
want.
if you want to, because
If it's better, then yeah.
this is the cool group anyway.
Right. But the choices are financial stability, thriving neighborhood, family health, and supported educators.
Probably supporting educators.
Okay, great. I'll go ahead and pop you in there. Hey, Liz, Catherine. So you guys actually have the ability to hop into these different rooms if you wanted
And
to
listen, huh?
see what's going on, or just like, like be a little fly on the wall and listen, if you like.
I think I'm gonna stay out just because we have a first 5 person
In everybody's
rooms.
Yeah.
Yeah. And so I don't want to disrupt the flow.
All right. Well, in that case, why don't we talk about Halloween and how that went?
Oh, wait, sorry. What's up?
How was your Halloween?
Oh, it was so good, Leah. It was just, I mean, we're not out of COVID, but it just felt really nice to do normal trick or treating. And we went to our friend's house in Oakland who gets a lot of trick or treaters, and
oh, nice.
we did lots of handing out of candy, which is my very favorite thing in the entire world, is to hand out candy. So,
Oh,
how about you all?
It was good. I just sent you a picture of our costumes.
Did you text it or email it?
Text it. Oh, and you know what?
Oh,
and it's so cute. So cute, right?
Love it.
Yep.
Love it, love it, love it so much.
I just realized that I didn't start the timer. So I don't know when.
How long are they supposed to be in there?
It says
15
minutes, but I totally, I don't know how long we've been doing it.
So Imelda,
5, give them more, give them like, about 8 to 9 more minutes. Because what time is it now?
It's
It took us like
12:11.
5 minutes.
Yeah.
It took a time just to assign it.
Yep.
And kind of like bring them into the rooms, I should say. And then
excuse me.
Yeah.
Yeah, I hope they're having good conversations.
I do see microphones bouncing up and down, which is, and cameras are on.
Yeah.
Yeah, so that's good. That's a relatively newish feature in Zoom, that where you can, as the host or co-host, you can see the interaction that's happening, whether their camera's on, whether their mic is on.
That's Chris is definitely talking.
Good.
I wonder what's going on over there, family health and well-being.
Yeah.
Well, some people might be talking, but I noticed that we can't see everybody's icons. Those are probably people with either some sort of setting that doesn't allow us to see that, or it could be that they don't have an updated Zoom.
Oh.
So it's not perfect, but it does give you at least a little bit more of an insight into what's happening, you know, in the rooms, which is a welcome addition, new feature.
Yeah, that is helpful.
Anyway,
in thinking about this, yeah, I don't think we should have done so many rooms. We'll know for better for next time. But it's funny because ECE and K transition supports were also the rooms that like were last volunteered for our staff too. And so I'm like, it just kind of gives you a sense of maybe what resonates more with everyone.
Well, I wonder if maybe because people's backgrounds are not in ECE and kindergarten transition, that, you know, like maybe they feel like less qualified to discuss that one. All right, I'm gonna give everybody a so we're about like
Dawn's talking now. I think if I was able to introduce myself that I'll be popping in and out, then perhaps it'd be nice to pop in and out. But you know, like Liz said,
you don't want to get in
it would disrupt it. It's
right.
like, it's nice to pop in and out, but then if you don't give them a heads up, it's kind of like, okay, what are you doing?
Right.
You know,
surprise inspection.
How do I include you? How do I include you in this discussion that we've been talking about for the past 5 minutes already? And you just jumped in. And so, but yeah. We'll hear the feedback, I guess. Liz, do you plan to doing a debriefing afterwards? Because you were talking about like not many rooms, and do you guys typically talk about this afterwards, or what's your guys' process?
Talk about it next time we have it. Yeah. Well, and it's a little different because this one is being sort of like our trainers are the PPE team.
Yeah.
And so the people who will kind of go over to the next learning community will be myself and Maria. For sure, as far as like staff members, and then it really depends on topic as far as who else would be planning it.
I'm just curious what the process. So initially it was Lisa and Laura that actually reached out to you folks. And then...
yeah, it was actually a conversation that I had with Jane Wellenkamp, who I think she retired right before you started, I think. And so her and I were talking about this, and she was on the policy planning and evaluation team. That's how we kind of came up with this topic. And I knew that they needed to disseminate this information. And that they wanted a chance to talk to all the neighborhoods ready for school sites. So yeah.
Nice.
But yeah. How was your Halloween, Catherine?
It was good. Trick-or-treating with my kids. Yeah.
Nice. I seriously, like I already said, I was just like, oh my gosh, next year. So I took off yesterday. I'm like, I'm taking the first off next year as well. Like, what would we? Because it was really
like,
nice.
Why not do both, right? I was just talking about that with Leah a while ago. I'm like, God, we should have had today off,
or at least the morning. Yeah,
it's rough.
Wake up late, now, because like you're going to sleep late because you just came from trick or treating and. Or hosting or whatever. So
and that level of excitement and activity and
the kids were bouncing off the walls. They were very excited and happy.
Right? Oh, I was like, no more candy, please.
Well, the Switch Witch came to our house, which my daughter knows is me, but all the candy is pretty much bye-bye. And so she's gonna get to pick out a toy because I'm the worst mom, meanest mom.
We actually took their candies.
Yeah.
We took their candies. Technically, like we let it sit for a while. Like we kind of like screen it. To make sure that it's okay and not that we don't give it all to them. Usually I just donate it. I just like give it or donate it. But yeah. But an interesting thing is on our trick or treat last night, I just remembered right now, there was a house that decorated their whole backyard.
Wow.
Like literally, there was like each station had like a statue moving. Yeah, it was.
Oh, that is awesome.
That's
Catherine. When was
aggressive.
that?
So yeah, I was like, some of our blocks, they get so like intense. I mean, this past year was not as decorated, because normally you'll see like the whole street,
Mhm.
each house decorated, because it's like they all collaborate together to decorate. So, but because of COVID, it all changed. It's not the same anymore. So
Mhm.
yeah. Sad, because now we're gonna see that with holidays, right? With the upcoming holidays, especially Christmas. I mean, it's hard to see that with Christmas. How many more minutes do we have left to go? Where are we? Good time. 12:18.
I'm gonna give people a 3-minute warning.
It is really raining out there.
Mm-hmm.
They weren't joking when they said it was a chance of rain this
Okay.
morning.
Now, I'm not a scientist at all. But do we feel like, knock on wood, like fire
Yeah.
season might be okay? Like, or I don't know. I feel like we're in November, like we're getting rain. There's supposed to be rain all next week. Like,
I have no idea.
So hard to say.
Yeah. I'm hoping it doesn't rain on Saturday though, because my son has a cross country championship meet.
oh, bummer. Yeah, is it supposed to?
I haven't even checked that far.
Yeah.
That would suck.
Mm.
Yes.
I'd really be so sad.
Did they cancel for that for rain?
I have no idea.
Mm.
I guess I'll find out. Man, Chris was very, very, that was a really deep appreciation that he shared. It was really kind, really, really nice.
Yeah.
And you could see he's well involved. So, you know.
He's for sure one of our shining stars.
Yeah.
I know. I think they had talked about, oh, do we need to prep him? I'm like, you do not need to prep him. I'm just going to let him know that, and that's all prep he did himself. But it's clear that he did some preparation.
Oh yeah, definitely.
But
yeah.
I was like, oh no,
he knew what he was going to say.
Yeah.
And he mentioned that he reviewed the slides. I mean, it's intentionality.
Okay, I'm gonna be closing the rooms now. Okay. And they'll have a minute to wrap up their conversation.
And then Leah, did you get that email that I sent you with the head heart?
Yeah, so I do have that. So when they get to the end of the slides, then I'll change screen. I'll change what I'm sharing.
Perfect. Thank you.
Yeah, if I had a little bit more time, I would have added it to the slideshow, but that's okay. It's all good.
Yeah.
We'll make it work.
Hi, everyone. Welcome back. Starting to see a few faces trickle back in. I think we could stop sharing your screen right now just so we can see each other. And then, thank you, Leah. It'd be great just to have folks share what came out in their groups. You could do popcorn style, or we can call it, go back to the roadmap and go group by group.
I could go. This is Jennifer Hawkins from the Union City Family Center. Nice to see everybody. It's been a minute.
I was in the health and well-being group, and just I guess some highlights from the conversation. A fact of 40% of children missed wellness checks in this past year, as well as, on the contrary, the NRFS sites, more of our children were able to access those wellness opportunities or attended their wellness checks. It's just, I think some of the things that came out of that was, advocacy and highlighting the importance to maintain these wellness checks, having an opportunity for accessibility, whether it's bringing a mobile unit on site and promoting that particular resource. Another highlight that kind of came out or wondering was, just the lack of basic needs and access, for example, transportation to and from these particular appointments, the lack of transportation, as well as possibly even not having enough for a copay. So what do you balance, a wellness check or a more urgent need, a medical or an urgent need? So, and then it's impacted by loss of jobs, just not having that access. We also talked about, basic needs like free diapers, food, navigation services. It's just having that all in an area is very helpful. One of the things that I wanted to give a shout out to is possibly having other cities being connected to urgent needs. For example, sharing a resource like diapers, like, hey, do you know that these folks also refer folks to us that could utilize this particular service, whether it's food, diapers, or another resource that you can share. So really getting the word out to make it more accessible to families so that they don't have to travel so far for urgent need. So those were just some of the highlights of our group.
Thanks, Jen. Anyone else? Any other groups? Some highlights, reflections?
I can go. This is Carrie from Lincoln. I was with Ruth and Laura. We are in the financial stability group. We were just talking about how, financial stability, as was already stated, kind of feeds into all the other aspects of kindergarten readiness and just well-being in general. And we were discussing like the different barriers that there are to this financial well-being, maybe English proficiency or, just resume support or just education in general, and how we can support with this and like with families' career development. And we just also talked about how resources changed over the pandemic. Like some things were available that weren't available during the pandemic. Some things were much harder, like childcare during the height of the pandemic. So just discuss the different changes in resources as well.
Thanks, Carrie. Anyone else?
For our group is the educators group, and a couple of things that were lifted up. I was in a group with John, Shanice, and Tiffany, so thank you, everybody. Just a couple big items. We had a really rich and beautiful conversation. Both Tiffany and Shanice are family navigators, and they really spoke from their personal experiences as mothers as well. Really just lifting up how Shanice, as a second-time mother to a young child, is able to recognize and able to really implement some of these early childhood strategies in a different way now that she's had more experience, which I think spoke to some of the ECE education both lived and provided as well. And then Tiffany also spoke to, just thinking about specifically how systems can support TK and kindergarten teachers on a much deeper level to take care of basic needs so that they can focus more on their deeper expertise in the skill set in which they were hired to do, instead of really focus on things like supplies and things of that nature, right? And one of the things that also John brought up that I thought was incredibly poignant is, as we're thinking about educators in the KRA report, the most and the highest priorities of what educators name was vastly different than what caregivers name. And that is, I think, a significant data point to how we're thinking about kindergarten readiness in the Neighborhoods Ready for School initiative in further years, especially here at Lincoln, how we're thinking about it. And one of the things I would love to continue to explore and think about with this wonderful group here is how each site really engages with educators in the area, and we could define educators in any way in which we need to, but recognizing that part of that continuum or the lack of a part of those, new protective factors essentially of the beautiful roadmap is be able to actualize and think about how educators are really folded into that as well.
Thanks, Chris. All right, so I think that's all the time we have now for reflections. Thank you everyone for sharing. Leah, can you share the screen just really quickly again? Around second to last slide. All right. So before we wrap up, I just wanted to share where to find a report. Our report's available on the website. There's also a link to our policy and action section where you can find examples of how we've used this data to advocate for additional supports for communities. And then just some contact information. And I know we have one more activity left, so I'll pass it over to Liz.
Oh, thank you, Deanna. And I just want a huge thank you to everyone who presented to us. Jane, Deanna, Laura, Chris, I appreciate your insights, and everyone for going to the breakout rooms and being open to kind of share and reflect on what this sort of means to your day-to-day work. And just always happy to see you all in one place as well. So